go ahead and record. Okay. And so our first, I'm just going to go down. Hey, Joanne, saw you wave. I'm just going to go down our agenda here. And first item that I have on here is um, on the seminars in pediatric surgery that Sarah and Grace were leading. And congratulations, you guys. You submitted it to Marianne.
Thanks. It was a little, I'm driving, so I apologize for the noise, but
Oh, that's all right.
it was a little bit of a tour de force, but I'm glad we got it in and looking forward to getting the feedback from Marianne.
Oh, perfect. Did she let you know when to expect feedback or?
Uh, no, not yet. Not yet.
Okay. Yeah, that was definitely a great effort from everyone in the subcommittee. I was just marveling at how it came together and how you guys put in those major final edits, and it looks fantastic at the end. For those of you who saw the draft that was sent in, I thought it was fantastic. Great job to everyone who worked on that. Okay, let's see. Let me open up the participants. Okay. I see that Colleen is here and hopefully Mahul will log in or get a chance to log in. Um, the next item is about the sustainability workshop at APSA. So we had a lot of really great discussion already on the subcommittee. And I think this is a really great time and chance to talk about that a little bit more. So Colleen, do you want to talk about that? You're muted, Colleen.
Sorry about that.
That's all right.
So the plan for the workshop is it's a workshop, so it's like no AV support in the room. It's anticipated to be about 100 people that would attend. And our plan was to have in the space like kind of three stations, and each station would be about 15 minutes each, probably a little bit less by the time we do an intro and a wrap up at the end. And people could rotate from station to station, so that everybody who's attending the workshop would have a chance to rotate through each of the stations. And the idea is that we would have people at those stations who could talk about projects that they've done at their own hospital that they had real world success with, and just to try and distill it down into a practical guide for somebody who might want to implement the same type of project at their own institution. So, who were the key stakeholders? What were some of the logistical challenges? How did you overcome them? What were the wins? How did you collect data? What data did you collect? Those sorts of things. And I think Mahul had included on one of the emails like a framework that we could use to um, have the people who are going to be presenting, put together like a synopsis of what they would be presenting, but that could be like a handout that people could then take with them away from the meeting. And the initial three stations that we had thought about, one would be energy and energy efficiency in the operating room. We were looking at instrument tray optimization, and initially had talked about instrument reprocessing and recycling, but I know there's also been some discussion about doing anesthetic gases as well. So I think we just need to kind of see what the interest is, in each of those different categories, and then kind of, I think, finalize the three that we're going to go with.
Okay, so the three were energy efficiency, like HVAC, tray reprocessing, and
No,
anesthetic
instrument
gases.
tray optimization.
Optimization. Okay. Reprocessing is a different
Yeah,
category.
reprocessing and recycling would be a different category altogether. And then the final one was anesthetic gases.
What if you made it like a choose your own adventure. They were pick 3 of 4, right? Because time's limited. You can pick 3 of 4.
Hmm.
Whatever station you didn't attend, you could grab a handout from them. And I think the anesthetic gases is a particularly interesting one, has captured a lot of people's attention who are aware of it. I just don't know if the surgeon crowd is the optimal audience for it, as opposed to, the Society of Pediatric Anesthesiologists or American Society of Anesthesiologists. But we could have 4 and let people pick 3 and grab a handout from the 4.
Yeah, I had actually thought about that also. If we have 100 people show up in the room, having a small group discussion with 33 and a third people might be a little bit tricky, right? So if we had actually more stations, it might make the group sizes a little bit more manageable. So I actually did kind of think about that as a possibility as well.
I kind of like that idea too. I remember you were saying that you wanted there to be scribes or people who are not actively presenting in one of those stations take notes that can be given out afterwards. And if you maybe did only 3 out of the 4 stations, it might be a little bit of more of a motivation for you to like look into those notes so you can pick up that fourth one that you missed.
Yeah, that was one of the other thoughts from, just if anybody from the committee who's going to be at the meeting and wants to participate. I think even if you're not presenting, I think we could certainly use people's help with like note taking or, scribes, so that the information that does get shared can also be collated, right? Because I can envision a scenario where we have somebody set to present on instrument reprocessing or recycling, and somebody unbeknownst to any of us shows up and is like, well, this is what we're doing at my hospital, and it's a whole great thing, right? And we don't want that information to get lost. And so if we have designated note takers, then we can kind of collate feedback from all of the discussions and share it with the session participants.
And do you
So
guys
I
have a
guess
timeline or
well,
deadline that you need?
we have to have everything submitted to APSA by the 5th of February. So we actually really only have like another week or two to shore this up. So I guess for each of the different categories, I know there was some online discussion as far as people that would be interested in different things. And I'm actually not even sure, as I'm looking here at the screen, who's on the line, in terms of, who might be interested in leading discussion for a different topic or different category.
Remember, Raman, you were talking about was it reprocessing and recycling?
Yeah, exactly. I'd be plenty happy to lead that part up, the reprocessing and recycling, which is kind of parallel but separate. And I think was
Could
it
you
was it
bring
Mahmood
just one of those topics?
in the energy?
I think, say that again.
Was it Mahul that had the interest, and they done the work on the energy usage and powering down and setting things in a standby and all those elements?
Yeah, it's Mehul. I'm sorry, I was late, so I just got out of the OR and jumped in. So I heard most of what Colleen just said. I think we're at the stage now where we actually need to really identify who's going to take ownership for whether it's 3 or 4. I think it's fine, but each of those topic areas, and if we're going to talk about, for example, recycling and reprocessing, I think it would be better if we talked about one thing and really use it as an opportunity to walk people through step by step. When you go home to your respective centers, if you want to stand up a reprocessing program, here's kind of a blueprint. And to actually bring that as a handout to the session so that the people that stop by that station, it may be 10 people, it might be 25. We don't know, right? And we don't know how many people are going to show up. But they could walk away with pretty explicit instructions on how to implement this at their respective centers. So for energy, there's tons of topics we could talk about, but and Allie's on the call as well. She's one of my research fellows. She's going to be presenting our experience with setting back our HVACs to basically Joint Commission minimum standards. Our HVACs were turning air over at about 30 times an hour, which is every 2 minutes, and the standards are closer to 16. And so we actually did that and are going to be presenting some of the work as a podium presentation. She has a podium presentation. And so, but that doesn't really give you an opportunity to tell people who was on that implementation team, how we worked with our infection prevention and control colleagues, exactly who from engineering at our institution did we get a hold of to actually turn down the turnover time, and to actually make the changes. How did we quantify the energy we saved or the dollars we saved to make the case? And so while her podium presentation during the session, during the conference, will be kind of a, background, methods, results, and conclusion type of presentation, as you would all expect, this workshop would really be more of the how do you do it, and how do you get it done, how do we scale it? And so what would be great is if we could get a volunteer for each of those four. And it sounds like we had already identified some via email, and I'm pulling up my notes now from that. But for every one of those individual folks that are leading a specific area, to start working on a tip sheet, a how-to guide. I had actually attached an implementation framework to one of my last emails to the group. So if you want to use that, you can use that, but you don't have to. If there's a better way of doing it, then try that way. But that's the concept.
Okay, that's great. Thank you, Rahul. So is Allison going to be leading the energy efficiency topic, or will you be leading it?
I'm opening it up to Allie. Allie, you're on the call, right?
Yes, yeah, I'm happy to do that
Okay,
in whatever kind of format you all think is best.
that's great. And then the next topic that we discussed was instrument tray optimization. Was there somebody who had specifically volunteered for that one?
Yeah, I had volunteered. I can share my experience of optimization of tray at Sick Kids.
Fantastic. Okay. And then, so that's Annie. And then anesthetic gases. Was there someone who had specifically volunteered to
I
lead
was
that?
one of the ones who had brought that up in the email thread, just because as a research fellow at Seattle Children's, I had worked both with the Department of Surgery and with anesthesia on Project Spruce, which they've now scaled up to 18 institutions. So I think it's a model that would be pretty easy to blueprint and advertise, although I recognize that it's predominantly within the domain of anesthesia. But I think it's a way for pediatric surgeons to become more aware of the environmental impact of anesthetic gases and an opportunity to collaborate with their anesthesia colleagues if they're forming perioperative green teams.
And is there, probably like a rhetorical dumb question, but is there like a data collection aspect of that, something that you can
They are collecting data through Adaptix. And so, I mean, there's a consortium website with the ability to sign up for Adaptix and link your EMR with the Adaptix to collate that data and analytics support.
Yeah, but you want to make it to where everyone can do it, right? So I'm happy to work one-on-one with everyone on their kind of handout and blueprint for what we're recommending. Because Hannah, you got to think it's actually quite easy. What you're going to do is you're going to talk to your supply chain team and ask them how many bottles or buckets or barrels or however desflurane versus sevoflurane is purchased at your individual hospital. What you're going to want to see is that you're dropping the purchasing and switching to the more sustainable gas options. And so, you don't have to have fancy memberships to practice green health or costly multi-institutional collaborative type of thing going on. You can literally talk to your own supply chain and quantify these things. And so, yeah, I think it's perfect. And as long as you're, Hannah, just to confirm, you are going to be able to attend the meeting and the day, and this is true for Annie and for Allie as well. The session is on Saturday morning, right? So it's kind of the last day of or I think it's the last day of the conference. So making sure that you all are
I've arranged my call schedule to have that weekend off.
perfect. Wonderful.
it's Saturday morning, what time?
So they've given us a wide window, 8 a.m. to 11 a.m., because I
That's
don't
right.
think the program committee has actually given us an exact time. It's not going to be a 3-hour session. Don't get nervous. It's going to be probably on the order of a 45-minute to 1 hour session, I think is what they've told us.
Yeah, that's right. I think Miriam was trying to make sure it doesn't conflict with, I think it was obesity. It was another advocacy workshop that was conflicting. Okay.
And it's meant to be a workshop, meaning this is not supposed to be a panel of people just lecturing from the pulpit. It's supposed to be more interactive. It's supposed to be, I think, the rotating to 4 different stations, or if time only allows 3 of the 4 stations. I think that makes a lot of sense. So,
And sorry,
Raman, do you want to talk about reprocessing or recycling, or pick a piece of that to share with folks?
Yeah, absolutely. Because I think those are some of the most tangible and easy to launch accessible elements for people, to begin sort of sustainability awareness and efforts in an OR, just starting with recycling, where there's a whole infrastructure there, and building it up and giving people practical steps how to stand that up. So timing is short, so we can pick between the two. But I think we could probably, split that time and say put 2/3 of it on recycling and 1/3 of it on reprocessing. Or we can make it skip. I mean, my personal bias is I think that the influence of both of those, and this is not to belittle the value of the contributions and awareness that have grown in the venting of anesthetic gases directly into the environment. I think that these are more tangible, concrete, and directly relevant to the general OR staff.
Raman, at your shop, have you navigated establishing a new reprocessing program at your center?
Yeah, recycling and then into reprocessing. Like over the course of 10 years at Phoenix Children's, I've been developing a pretty. I've lived a lot of these lessons and the stumbling blocks, and like exactly like you were saying, learning who you have to partner with, how you launch successfully, what are the stumbling blocks that you want to avoid. Setting realistic goals at first. I can speak with from genuine experience about those lessons learned.
If I may push you towards one of those, I would say that a lot of recycling programs have to do with your overall waste vendor contracting. Some waste vendors claim to be recycling things after they pick it up in bulk, but reprocessing programs and purchasing back products once you've been participating in them for a finite period of time is, like, I think, really attractive to surgeons. And I think a lot of surgeons would be interested in that aspect or that story a little bit more. What does the committee think? Open it up to everyone. What do you think our constituency, our peers would want to hear more about? Both, or should we focus on how to set up a reprocessing program with a little bit more detail about that aspect of it?
So I I agree with you, Mehul. I think that we ought to pick one out of those two because I've heard Raman talk about these topics. It's fascinating and it's huge. And I don't think that the time allowance is going to give enough in depth for both topics. For me, I feel like the reprocessing aspect is more interesting. I mean, recycling, I feel like once the items are collected, I don't really know what happens to it. I do have some questions and, would love to hear some ideas about how people get others to participate in recycling and sorting and stuff like that, and how how you maintain transparency through the process and how you know how much you're actually recycling. But I don't know that I know that much about reprocessing. And I'm not sure that we use reprocessed items in our OR.
I think that's actually a really attractive thing. Go ahead, Chris. Sorry.
Yeah, no. I was going to say, Linda, I bet you probably do use reprocessed items in your OR. I would find it actually hard to believe that your supply vendors and your hospital and your OR system doesn't have some sort of contract at minimum, for reprocessed items, everything from your ligashore to your harmonic or anything like that, for just as an example. And I think for the general pediatric surgical audience, having the opportunity of taking something back to their institutions with hey, I want to be more of a surgeon champion along this line, they probably have more opportunity of taking the recycling component, because we all know that as good as we try to participate in, so many things don't get recycled right there in front of you. You know that. And if you look at a children's hospital, part of a large hospital, certainly like I participated in most of my career, the pushback is always, here you are doing the work that you possibly can for recycling in one room, and yet in an IR suite where endovascular things are just ripped open, torn apart, and there's lack of recycling, that's where you can have more bang for the buck. That's not to minimize the repurposing. I think that's, super huge. It probably just goes on as part of our supply chain without a lot of people really noticing that they're using a reprocessed, ligashore, for example. I know in our place,
yeah.
For example, our place, we're like we're a big, green hospital, top awards and everything like that for all kinds of sustainability in healthcare. And yet in our operating rooms, we struggle for the basics, which is the recycling, process. So that's just my 2 cents. But I know that even our place would benefit from a blueprint and some playbooks that some other people have been successful with.
I'm curious to hear from others. Does everyone feel like you guys are using reprocessed energy devices and things like that? Chris,
For sure we're not.
I think you're benefiting here from the adult, the supply chain being similarly shared between the adult hospital and the pediatric hospital within the hospital, so to say. I would argue that I think that most children's hospitals are behind, in the sense that I know at Northwestern across the street, they're using reprocessed equipment every day. And we just after a year and a half, 2 years of pushing, just began purchasing back ligashures, like just in the last couple of months.
I'm glad you brought that up. I appreciate that now that you say that. Yeah.
So I will say that we are a children's hospital and an adult hospital in a huge system, and we are not purchasing back anything. And there's a lot of discussion. There's a big infection control concern. Then there's, will the surgeons use it? Then and seems like it's not dumb, but it's like, I would have never even thought about this, but the SKU barcode on a new instrument versus a reprocessed instrument is different because they're coming in from different vendors, right? So if you have a Medtronic device that you reprocess, it's not coming back from Medtronic. So how do you put those on the shelves? And then how do you have a surgeon's preference list opt for either the reprocessed or the new instrument? And then just interestingly, we had a Medtronic rep in the OR the other day who was trying to tell me about the reprocessing that they're doing, but Medtronic buys back their sold equipment to basically incinerate it, and they sell, or they pass off the benefit as it's energy generation, but it's actually not truly reprocessing. And so there's a lot in terms of like contracting and big business and big contracts that's also part of this reprocessing thing. But I do think, if Raman, if you have had success with this at your institution, like I feel like the instrument part of reprocessing versus recycling is something that's, surgeons can own that, right? And I think it takes surgeons to push their peers to say, actually, even though this is reprocessed, it's tested more rigorously than something that's coming fresh off the inventory line of a new company. And so it actually has a, better chance of working properly, right? So I think there's a lot of elements to it that would be worth discussion with a group of surgeons.
Amen to everything each one of you guys just said. And I've just recently been in big meetings with national leadership in some of these, with industry, with the reprocessors, and have been out to to visit a reprocessing facility and tour it and speak with the leadership there as well. I'm just going to keep shaking my head and smiling. It's like choosing between children to say whether to talk about reprocessing or
You all
recycling.
got a favorite.
There's so much, right? There's so much value to be transmitted and lessons learned to be shared, information to be shared. And I'm excited to carry the torch for whichever we decide we want to devote our time to. But you're right. There is, while there are many places that are utilizing reprocess instruments and potentially doing so unaware because supply chains have slipped it in on you. Looking at the national figures from the industry side of it, there are a lot of places that are not, and there's room for expansion, and there's a lot of negative stigma driven by surgeons. I'm never using a reprocess. This is garbage. Send it back. Turns out that was OEM. That wasn't reprocess that you were complaining about.
The other aspect,
we're up against a tough time right now, obviously, given the administration changes and the big elephant in the room, which is, well, tell me about that recycling program. What really happens after I put blue things in blue bags and red things in red bags? And what do I really know? There will be tons of doubting and doubters on that side of that. And I'm thinking of that based on your comment, Raymond, and I'm thinking about the workshop takeaways, Mahul, like how do we have enough information to provide, here's how we went from 0 to 100, or we're close to 85% with one topic, so we should choose that topic? Like, do we have enough of that personal experience at an institution to say, here was the blueprint that really worked for us? Because both topics do really require so much input above, that individual surgeon champion.
As the one volunteering to speak on both these topics, I'm happy to say that I have data from our institution and I can speak to it, with some black and white and numbers, either one of these topics. The rubber hits the road more easily with recycling. They're both super important, but it's easier to stand up recycling and get at those questions you're bringing up, like, oh, how do you find out if you're putting the right things into the waste stream, or what's just ending up in landfill, and how do you inquire about these things? How do you tune up a recycling program?
Well, Raman, if you're the one leading us on that aspect of it, I think we can all trust that if you think recycling is the one that for which we can learn from, and that's the one you think that would be better for surgeons to walk away from this session having learned, then great. I'm fully supportive of that.
Okay, I can informally reach out to other people here and there and just say, hey, what do you guys want to hear about at APSA? We got this great session we're super jazzed about putting together.
I think that this is that venue though. So I don't want to sound like I'm being too stubborn, but it's January 23rd. They need it by February 5th. We need to give them titles and topics. And I think we've got a hell of a lineup. And so I've written it down: energy conservation with HVAC setbacks, Ali Lahane; optimizing surgical trays, the sick kid experience, Annie; strategies with anesthetic gases, the Seattle Children's Experience, Hannah; and then establishing an OR recycling program, Phoenix Children's, Raman. So, I mean, I think that's an awesome session, and I don't think that we should make it too much more complicated. And then, Colleen and I will submit this back to the program committee. They might have thoughts. They might push back. I don't know. So they might just accept it as is. But then what Colleen and I will do is work with each of you four as point people to put together, a one-page handout. Nothing too crazy, but that way folks can leave with that in hand, take notes on it, whatever. It may have references to any publications that we can, put together that support each of these four endeavors. And obviously, we'll put y'all's names down as the point of contact if people want some additional coaching or things. And then last but not least, my hope is that we will take these four handouts and post them on the APSA Quality and Safety Committee's toolkit. because to me, the overlap between quality and quality improvement type projects and or sustainability projects are the Venn diagrams are immensely overlapping, and so we could post them to that, have a green OR folder on the APSA Quality and Safety Committee's Google Drive, and just keep adding to them as the years go on. But maybe this is a series. We could propose a similar session again next year if this one goes well and is well received.
Yep. That's what I was hoping to suggest too, that we don't have to exhaust all of our topics this year in 2025. If there's a ton of great projects, and we could do the Sustainability Workshop 2.0 next year and just build on what we've started, and people will know the sort of product that we're putting out and know whether or not they want to attend this workshop year after year at APSA. And yes, I think that's great to, if we have those tip sheets, we can post them online. The sustainability webpage has a toolkit that Wynn already started developing. We can add these on. Her toolkit is kind of more like a general sort of thing. And it gives ideas about different topics, but it's not very granular. So these tip sheets, as we start to build them, can, flesh those out.
Just
now these tip sheets are going to be like QR codes and electronic, of course, right? The last thing we want to do is show up in a bunch of paper. But
yeah, that's right. It's all in using recycled paper and environmentally sustainable ink.
Yeah, everybody just use your phone to get it.
Just quickly adding a Deep South perspective as someone who's living in a city that doesn't have municipal recycling, who works at a hospital that has no recycling because we don't have the municipal infrastructure. I don't know what the data is, but I assume that there are some other southern cities in a similar situation based on my travels in the Deep South. It makes establishing a recycling program really challenging.
Hey, so Hannah, what do you know? What happens to all of your disposed stuff? Out of curiosity, I mean, I haven't been.
Landfill or incineration.
That's it. I mean, that's bottom line, huh?
Okay. Michael, is there anything else that you needed from the group to wrap this one up?
No, I've just made updates to the working document. I'll circulate this to everybody, and then we'll take care of it to submitting it to APSA. Stay tuned.
We will. We're very excited about this one. Okay, so then the next item is about the APSA position statement, and certainly with this administration pulling us out of the Paris Climate Agreement again, makes, I think, our position statement even more important in this environment. So Colleen and I have, talked about it and kind of made small revisions at this point, because we've definitely worked over this position statement a while. And we are going to submit it to the board at this point. We understand that very likely they're going to come back with some critiques, criticisms, and hopefully a chance to edit and resubmit. So that's our update for the APSA position statement. Do you guys have any questions or concerns about that?
When are you submitting it?
We're pretty much ready to submit. And Ken, actually, a good question for you would be, how do we submit it? Who do we give it to?
I would send it directly to Tom Tracy, as well as Marina and Jennifer James. And it'll be presented at the next board meeting, or it might actually happen at the strategic planning. I'm not sure. Sure, it's probably going to be at the next board meeting, which is be in February.
Okay.
Ken, have you seen it? Does it align with what we've done for the AAP section on surgery and what we're proposing through AAP?
I haven't seen the final draft of the position statement.
It hasn't changed materially since the last version that you read.
I mean, I think it aligns with what we're doing in the AP in terms of creating the position, or sorry, the policy statement. So I think it aligns. I mean, that there is really nothing contentious on your policy or position statement. I'm getting all these position and policy things mixed up. Your position statement. There's nothing controversial from a science standpoint. Um, so yeah, I think it'd be fine to just push forward. I mean, just have to see what the board thinks, and I mean, I don't see any reason why they're going to turn it down, honestly. I mean, I'll support it as much as I can at the board level, and indicate the importance, as you've mentioned, of why a position statement like this is necessary in this current political environment.
Thank you, Ken. Okay. So then with the perspectives, moving on to the next topic, JPS, we have two topics with this one. One is the perspectives paper that Colleen, Chris, and I have been working on. And our plan was to we're still working on editing that one. And our plan was to send out the position statement, see what is like sort of the final approved version of it, because we have a suspicion maybe some things need to be changed about it before we align the perspectives paper to match it more. Right now, the perspectives paper is very wide and broad and has a number of topics, and so we do need to narrow it down. Actually, I think to fit within the word count.
Although the perspectives piece, I thought when we discussed this some time ago, was intentionally left broad. In fact, now hearing everything that we're hearing and living through, if you have to narrow the position statement to be sort of dancing on eggshells but accurate, that gives us the latitude, I think, in the perspective piece to be, a little bit more broad-based. I mean, we're talking about how difficult it is to separate, the impact of climate health on children, and you can't do that just by climate health. You can't talk about that without talking about environmental injustices, et cetera, and so forth. Now, that's not a place for the position statement, naturally, but I might just pause a little bit on the perspective piece, see what you get back from APSA board with respect to the position statement, and I say we kind of go for broke in the perspective piece. I mean, it was basically an invitation to write it. Well, if I'm not mistaken.
Yeah, I do recall it seemed that way. Colleen, what do you think?
I think, I think let's see what kind of feedback we get from the board and then take it from there. And, I'd like to see if there's a different direction that we need to pivot, or, if they're happy with what it is, then I think it sort of changes the way that we would draft the perspectives piece.
I mean, I agree. We have to see what the board says, but I would, from my own personal perspective, I would do what you want to do. I mean, the board is not going to tell you what to do. We will support you in what you want to push forward with. Go for broke. I mean, there's nothing stopping you from writing whatever you want to write.
Okay, fantastic. Thank you, Ken.
Can I add something, Linda? Quick comment.
Sure, Joanne.
Oh, maybe just thinking about your perspectives piece and to make it really timely now that it looks more official, like we will withdraw from the Paris Accord, to actually make some comments about how that would impact pediatric surgery patients. Just a suggestion.
Love it.
Thanks. Yeah, that's a good point. I don't think we actually have anything on the Paris Climate Agreement in there, so
It's really timely and might help you to, get it picked up quickly for publication. I don't know, might require a bit of more discussion and thought about what the impact could be, but I think it could be quite persuasive and interesting, and also make the paper like more urgent for the paper to be published. And the other comment I was going to ask you guys about, as your chair for the larger committee, I would actually like to see us think a little bit bigger about your work. So I appreciate all those ideas about doing another presentation next year and toolkit and that type of thing, but I was wondering about connecting your group more with the American College work and starting to really identify places where we can advocate on a larger scale, similar to like we do with other topics. I think that might be an interesting thing for our next year for some of our deliverables to look at how we can advocate on a larger scale, whether it's partnering with ACS, looking at bills in the government, things like that, and just thinking a little bit bigger. We have had quite a bit of success with that with consumer products, and there's no reason why we couldn't think on that scale with sustainability. So those are some of the ideas going through my head as I'm listening to you. And then I think I had one more. I had one more idea, but it'll come back to me. But anyways, you can give me some feedback. You can give me some feedback on that.
Yeah, I've always been very interested in trying to find something in advocacy, and it would be more on like a local or state level. But despite looking, I haven't really seen that much that we can
Yeah.
that I feel like
I mean,
applies to like a pediatric surgeon
mhm.
or medicine.
Well, everything that we've done with our committee, we've had to start from square one and investigate. So we can do that with some of this work as well. Oh, I know my other thought was just listening to what Colleen and some of you were saying in your ORs and trying to get ideas through. My question is, do we need to have more of a collaborative data collection? Or maybe you guys are already doing this, but collecting more data so that you can write persuasive documents. It doesn't have to be a paper, but it could be to kind of take back to your administration or for us to publish, so that we have really good persuasive data for advocacy efforts. Because I heard each of you kind of saying, "Oh, in my OR, we have this issue, that issue," and you're all saying a little bit similar, and it sounded to me like something that might need data to push forward. So that was sort of the final thing that I was hearing.
Now, on the data sharing topic, that was something that we brought up very early, actually, in the group. And I remember Sarah Greenberg wanted to do something about that. We didn't move on with that, and instead got more into publications and manuscripts. And so,
Well, these
I
are
think,
long-term ideas.
yeah, they're
This is
long-term.
I'm talking about like when Colleen takes over for me, and 2.5 year deliverables. But they could be planning could start now.
Yeah. And a part of it would be like a question of what is the common data elements that we can all gather at our specific institutions. And I think Nicole and I talked about this like ever so briefly before. Like what kind of data is something that we can all individually gather in our institutions, that would make sense with sharing. So
I don't think we're going to answer it right now. It would be to involve other meetings, where you develop your data points and a little bit more review and discussion, but just something to kind of start keeping in mind.
yeah.
If I could piggyback off that just for a moment, I think for a couple of years now, what I've been asking different groups of people. So I think like some of you, Colleen and others have heard me say this, and like to the American College of Surgeons, I've said this to AAP, I've said this to a lot of different groups. Right now, one of the biggest challenges we all face is an inability to, in a facile way, quantify the impact of our ORs or our hospitals. And there's actually, like I've mentioned earlier in this call, like Practice Green Health and others have a really convoluted, labor-intense way. It takes hundreds, I'd say dozens, if not hundreds of people hours to like curate the holistic impact of any institution. And what once again, I'm putting a little bit of a QI spin on it. I think that perfect's the enemy of good, and we've got to have a low fidelity, relatively easy way to compare apples to apples. If Raman's done a great job over a decade of implementing these recycling programs and reprocessing programs at his center, and I want to be able to benchmark that and try to learn from that and implement those things as we're suggesting is going to happen after our session in May. Then, like, how do people quantify that? How do people what do they
Okay.
how do they
Can
know?
can I ask you something back then? What about just looking at cost? Like, can you show that when we implement sustainability initiatives that it is cost effective? Because if you can just show that it's cheaper, you may make so much ground uh, quickly without the more I understand all of the other aspects of what you're saying, but you asked, is there one thing that we can do to quantify? Can you show that it's cheaper? Because that's always a great thing to take as a persuasive point.
Absolutely. And
I think that's obviously a pretty obvious point. I would urge us to use the platform and keep the patient in the center of the outcome. Show why. I mean, I know, Mihul, you're saying we should come to a bottom line sort of metric that we can all follow. I think that would be brilliant if we can come up with a formula for that. I think the purpose of sustainability is to say that whatever we save in costs or revenue generation actually gets turned around basically right back to your community, right? It's patient outcome. So sustainability is healthcare, whether that happens in the operating room, a rooftop garden, a recycling program, you name it. One institution might have more experience in one area than another area, but the collective sum total is that the patient and the community benefits from it.
So better outcomes and lower cost. So you're kind of getting back to the triple aims of, you're getting back to triple aims.
Let me articulate it slightly differently, okay? Because I fully support the idea of demonstrating cost effectiveness. Otherwise, it's hard to move the needle, right? If it's a more expensive option, even if we would like to do it because we know it's the right thing for Mother Earth, getting our CEOs, our CFOs to sign off is nearly impossible, especially with the current constraints in most of our centers. Understood. And I'm passionate about wanting to help for the future generations and putting the patients first, right? Okay, let's say I can measure the cost and I can demonstrate that this is good for the key stakeholders. If I embark upon a project tomorrow, de novo, and I had all the resources available at my fingertips to measure whatever I wanted to measure, the way that I measure the greenhouse gases or the water waste or the energy expenditure might be different than if Chris were to do the same thing at his hospital. He would be using a completely different denominator of measurement. So then when we go later on to like try to, I'm looking at it from a very research perspective, a evidence-based perspective. If we go later on to try to do a systematic review or a meta-analysis of this, we have measured everything so differently that we're not talking about the same things. We're not comparing apples to apples and oranges. So, right now there's no there's no governing body, to my knowledge, that's telling us how we should be measuring sustainability. Should we be converting everything to gallons of water or tons of carbon dioxide or whatever it is? Part of the policy statements, the position statements, the recommendations would be that, gosh, it sure would be great that if in healthcare we should start measuring things and reporting them in these ways, if you can. And yes, we should be looking at cost and reporting cost. And yes, we should be looking at the patient and family impact and reporting on that to the best of our ability. But ultimately, you know, almost like a white paper or a guidance paper for if you're going to study this, measure it in these ways. In quality and safety, for example, we do that. We say, okay, I need to see a run chart, and I need to see, Six Sigma lines, or I need to see, PDSA cycles, or I need to see an aims and key driver diagram. We've given people the tools to implement quality improvement. You don't always have to use all those for every single paper, but it sure helps us to be able to understand what you did and to replicate that at our individual centers. So, maybe there's an opportunity now to actually say, gosh, let's all start reporting these things. And I think almost every other type of research does that now.
Was
Squire
there
I think the
anything,
framework,
was
the
there
framework,
anything from Joint Commission? Was there
the,
anything from Joint Commission, Colleen?
so Joint Commission, no. So the Joint Commission has now a sustainability certification. Essentially, if you want to get certified, I think you have to pick 3 areas where you are working on sustainability. You provide them with your baseline data, and then they come back for a repeat site visit in like 48 months, and you show that there's interval improvement. There is, I mean, the framework for reporting environmental impact exists. I mean, there's the greenhouse gas protocol, and that governs really any life cycle analysis that's done. And any life cycle analysis that's done should include a process map. It should include all the various stages of, product extraction, use, disposal, recycling, packaging. And so the framework for doing that analysis exists, and it's standardized. The problem is that in our supply chain it's very opaque. So for example, there's a study that compares the carbon footprint of an operating room in Vancouver, in Minneapolis, and in the UK, and the best they could do was just weigh all of the trash and assume that it was all mixed plastics, because you don't really know what exactly the metal component is of this, or which type of plastic this one is or that one is. And so the problem is, I think that's the biggest limiting factor, is really the transparency in the supply chain. Um, I think that will get better, and I think this will actually be an interesting place where AI may actually accelerate the way in which we're able to benchmark data, because there are companies now that are starting to develop like platforms where you could even have like an app on your phone and punch in what's the carbon footprint of a stapler, and it may not be the exact stapler at your institution, but I think over time there will be learning such that if you say, well, not that stapler, but this specific stapler, that you would be able to get some of that data back. But the problem right now is the framework exists. It's just really cumbersome, and a lot of the data that's needed is not accessible to the average person doing the analysis. Nor do most people know how to do the analysis, right? Like it gets complicated and can be tedious, and it's time consuming, right? Like you say, all right, well, I'm going to compare this operation versus that operation. It's months of calculating it, right? So it's not a fast thing to do at this point. And the basis for the practice green health tool is also based in the greenhouse gas protocol. But when you get to the level of system that you're using for like when you're calculating the footprint of an entire hospital system, again, because you don't have the granularity in each instrument supply, the alternative approach to life cycle analysis is to do it based on economic input and output. So that's where a lot of those, bigger numbers that you would need to be able to pull for the practice green health tool come from, it also makes it a less precise calculation, but it is at this point like the best available option and the best available uh, calculation framework that's out there. And it is cumbersome, and it's why I think a lot of healthcare systems are also hiring third-party consulting firms to do a lot of this work for them. And I would say most of the healthcare systems that are doing the work are probably only the ones that have signed the healthcare pledge, because otherwise there's not any real motivation for them to catalog their emissions across either their hospital or across their healthcare system.
Yeah. I think this question about metrics is really interesting and very important. Jen, thanks for bringing up this topic. I hope we will talk about this again, but we do need to move on at this point. So let's come back to that at our next meeting. So the next item is the Toronto Star reporting. I didn't see Sharmi on the meeting. Annie, do you know any updates for that?
Yeah, so she wrote the first draft. It needs work, and so we're working on it. And so hopefully, within she's doing her clerkship, so within a couple months, we'll be able to come back to you guys with something to show and get inputs from the committee.
Okay. And the goal is still to send it to the Toronto Star.
Yeah. As an update. Yeah.
Okay. All right, good. And then Sarah G, don't think she's on, so we'll skip her areas. And then Colleen, back to you. You have a survey on. Yeah, go ahead.
Yeah, so Amisha and I were working on a survey study. We're trying to just kind of have an initial meeting with people that were interested in being co-authors. So if you are interested in participating in the study, and basically the study is that we are going to ask parents when they come in for their pediatric surgery appointments is to take a quick, I think it's like a 6-question survey on their attitudes about climate change. If you're interested in participating and you haven't gotten an email from me yet about like a meeting, that like an initial intro meeting, just send me a quick email and I'll add you onto the calendar invite. Ami is working on getting the IRB approval at Rush at baseline, and then we'll figure out, what each of the other institutions is going to need as far as whether or not there's going to be a need for data use sharing, or if we can all just, sort of do it under her IRB and collect all the data centrally at Rush.
And that meeting is January 19th at 2 p.m. Eastern time?
That's correct, yes. And if we need to set up another one, we can also do a follow-up meeting if we need to. And we'll record it so that, if you can't make it, you can also watch the recording. And then the last thing on there, it's actually not an ACS survey. The Global Consortium on Climate Health Education has a survey that's currently open. It closes on January 31st. And it's not a long survey. It's looking at what medical schools are currently doing for climate change and health education at their respective institutions. The data from this survey, the hope is that it will, one, be used to guide one of the outcomes in the next Lancet countdown. So they're looking to incorporate what's being done structurally from an education standpoint into the Lancet countdown. So the data from the survey will help toward that. And then I think they're also helping to use the data from the survey to try and push the LCME to make climate change education more of a requirement in terms of medical school education. So I will forward the survey to everybody that's on the meeting invite for this meeting. If you are involved in climate change education at all, you can fill it out. If you know somebody who is at your institution, pass it along to them. If you know for sure that your institution's not doing anything at all, just fill it out with that information in it, that nothing's going on, because even having feedback that nothing is happening in a lot of places, I think is going to be valuable information to have to at least establish what the current baseline is. So I'll send that link to the survey to everybody. The survey does close on the 31st though, so it is something that you would need to do fairly quickly. It'll take all of like 10 or 15 minutes to fill it out at the most.
Okay. I have to find a medical student to ask them. All right. Well, great, everyone. Lots of really good discussion. I'm floored by all of you guys and your awesome experience in this. And we'll go ahead and end it here. I'm going to, put the recording on YouTube. All of you guys here don't need to look at it, and I'll send out minutes as usual. Okay. All right. Great to see all you guys. Until next time.